right. Well, hello and welcome to the September meeting for the Rural HPV Vaccination Learning Community. On behalf of the American Cancer Society and the National HPV Vaccination Roundtable, I want to thank you all for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. Today's meeting will be our last session of our summer series on quality improvement, and today we are going to be focused on PDSA cycles. So once again, we are excited to be offering both live and enduring CME and CNE credits for today's session. Next slide. So for everyone, I'm Ashley Locke, HPV Program Manager for Geographic Disparities here at the American Cancer Society. I have the honor of talking with you first, but I am a part of a much larger team that encompasses many colleagues from both the American Cancer Society and the National HPV Vaccination Roundtable who work on increasing HPV vaccinations every day. If you want to go to the next slide. So as far as our roadmap for today's call, you'll hear from Jessica Reed on PDSA cycles very shortly, followed by a very robust panel sharing their experiences implementing PDSA cycles. And then we are going to follow up with sharing some resources to support you on your journey. So I do just want to share a couple of quick reminders. All of our rural HPV vaccination learning community sessions are recorded and posted to a public-facing website. This session is certified for CME and CNE credit. We have added a link to the chat to a document that's detailing out information for our live CME and CNE credits. You can also find this information on our website. For CME and CNE purposes, none of the planners, speakers, or panelists involved in today's session have anything to disclose. And we are asking all participants to stay muted until our panel discussion. And as always, the Zoom chat is open and available for questions and support. Next slide. As always, both the American Cancer Society and the National HPV Vaccination Roundtable take a systematic approach to our quality improvement framework. This slide in particular showcases the steps we, along with our partners, use to not only improve HPV vaccination rates, but also cancer screenings. And today we will continue to explore evidence-based interventions and testing out their success or failure through PDSA cycles. Next slide. So before I introduce Jessica to all of you, I do want to do a quick poll to see what interventions you've implemented from our last session, if you've tested out their success using PDSA cycles and your familiarity with the PDSA tool. So Gabby, I'll ask if you could launch that. Perfect. And Melissa, if you just want to go to the next slide, while you guys are doing the poll, I will do our introduction to Jessica. So Jessica Reed is currently the Clinical Quality Manager of the Maine Medical Association's Center for Quality Improvement. She has developed, implemented, and supported multiple grant quality improvement projects over the last decade at various organizations, including a focus on prevention with increasing HPV vaccination rates at pediatric and primary care practices. Her HPV vaccination focus projects have included 3 HPV vaccination learning collaboratives, an HPV vaccination echo, and a recent HPV vaccination demo project. This prevention focus also includes other grant initiatives to increase breast, cervical, lung, and colorectal cancer screenings. Jessica is also the networking director for the Maine Primary Care Association's Patient Safety Organization, supporting federally qualified health centers in Maine with their patient safety priorities. She continues to design and implement quality improvement projects to help to improve the quality of care and health outcomes with healthcare organizations, health systems, and practices across the state. Jessica has been a board-certified gerontological nurse practitioner since 1995. She has practiced as a GNP in a family practice, a long-term rehabilitation hospital, and nursing homes. She received her bachelor's degree in nursing from St. Joseph College and her master's of science in nursing from the University of Massachusetts Lowell. So I'm going to go ahead and end our poll. Well, we have about 40% participation. I'll give it a couple of more minutes and then I will transition over to Jessica. So if you are just joining, we are doing a poll just to see where everyone's at. when it comes to interventions, familiarity around PDSA cycles, and actually testing out interventions using PDSA cycles. So if you have a chance, please go ahead and share your thoughts and feedback. We'd love to get as many participants as we possibly can to share. All right, well, I'm gonna go ahead and stop sharing, and I'm gonna pass it to Jessica to go ahead and start with her presentation.
Wonderful. Thank you so much, Ashley. And a huge thank you to Ashley and her team for the invitation and support leading up to today. I so appreciate it. So I'm so excited to be here with you all today. Just a couple of quick learning objectives to start off together. Obviously, we're going to be looking at some, as Ashley suggested, some quality improvement tools. I know that you've already kind of reviewed some things like aim statements and process mapping and gap analysis to identify areas to improve HPV vaccination rates in organizations, and I would say practices, and then comparing best practices and challenges in increasing HPV vaccinations in rural settings. Next slide, please. So I thought it would be great to kind of add a little bit of fun to our presentation today. And because I really think that this is a really great analogy when we think about quality improvement in general. So I've been asked to speak today about PDSA cycles, but I think you can't really talk about PDSA unless you really talk about the big picture around quality improvement. So today we're going to go rafting together. So we're going to go rafting down the QI River, and our paddles are going to be our PDSA cycles. So next slide. So again, our focus, as I've just mentioned, is PDSA cycles. And I think it's really important to recognize that before you implement a PDSA cycle and just jumping right into that, there really is some pre-work that I would highly recommend that you do, and we're going to talk about that together. You want to always include feedback the staff. I'll mention it a couple of times throughout this presentation, but really whoever's involved in this test of change, which is what a PDC cycle is, right? You're planning a test of change and implementing it. And again, we're going to talk about those steps, but really include the feedback from the staff who are the boots on the ground doing that work. Invaluable, because they probably already thought of something they could do to even help, right, with that process already. And always be thinking about sustainability. Again, I can't stress that enough either. I think that, as you think about the test of change and what you're working on, are they sustainable? If you lose that staff member that maybe is the point on that, is there someone else that can step in and continue that smoothly? So always be thinking about sustainability. Next slide. So here we go. So quality improvement is a continuous process. And I think this picture just really sets us up really well today. So thinking about this river, this is quality improvement. It's continuous. It's not just a one and done. You don't do one PDS cycle, check it off. You really need to go back and just reevaluate it from time to time. Is it still working? Is it still effective? Is it still making progress towards your aims and your goals? Next slide. So step one in this is planning for our trip together. So identifying our area for improvement. Next slide. For us, this is increasing HPV vaccination rates. When we think of that, we have this planning and implementation phase. So I like to call that filling your backpack. So planning, again, taking the time to plan and do some of this pre-work really increases the chance of success. And so we're going to talk a little bit about that. So who needs to be involved? Who's your team? I know you've had some education on this already, but thinking about who needs to be involved, using the quality improvement science and methodology that you've learned either in your career or through this collaborative, the QI tools that you've learned about, evidence-based interventions, and you had a poll on that earlier, so I know you've all been introduced to those pieces as well. And then I think a foundational piece, if you're going to work on HPV vaccination, is making sure that you do some type of in-person training, or it can be Zoom, I should say, it shouldn't have to be in person, but some type of training with your staff, your organization, whatever that looks like for your landscape, but really making sure that your staff understand HPV, they understand HPV vaccinations, they're comfortable with the schedules, all those pieces, because the more knowledge you give them, I always say knowledge is power. So the more knowledge you give them, the foundation you give them, the more apt and comfortable they're going to be about talking about HPV vaccinations with the patients and families. Next slide. Oh, not quite yet. So the other piece of this is when you're planning this is thinking about how are you going to know this is a success, so thinking about your measures, thinking about your process and outcome measures, which are different. One is the process and the things that you're doing and seeing if those are working and measuring that to get to the outcome that you want to be, which for us is HPV vaccination rates and increasing those rates. So thinking about that in the planning phase as well. So in your backpack, what do we have? So we have three different things. So you have your education that you have in just career, right? Yourself, the resources, ACES again is a wealth of resources and all the pieces that you have access to within this collaborative, as well as others, and then your internal and external. So internal to your organization, what do you have for resources? And then for external partners. The other piece we bring to this is lived experience. So our experience in our careers and the pieces that we've done around quality improvement, maybe this is your first time in this, but you also bring your lived experience in your career that has brought you to where you are today to be here to be talking about this quality improvement methodology. And then finally, again, the quality improvement methodology, there is a science to this, and we're going to talk about this briefly together next. So step 2, so you are all really the guide. So those of you that have been, or maybe some of you have been whitewater rafting, your guide is invaluable, right? He's in the back of the raft, he or she is in the back of the raft, and they are guiding you, right? They're calling out commands based on what's coming, the challenges that they see. And so you all, in my mind, are these rafting guides. And this is why you're here, to learn all these pieces, to be able to successfully support your teams and your staff in this work. And when we think of choosing the guides, you could be a leadership, right? That's planning a project. And next step, please. And so when you do that, you want to think about the project lead. You want to think about who is going to lead this work for you, who, right, is going to be prepared, organized for the trip. Who is it that is going to kind of hold this like in a project management role? And the other piece that I think is important, and we're going to talk about this, is they'll help to map out the first steps. I don't think you can begin the work in PDSA cycles unless you do a process map of your current state. And we're going to talk about that a little bit later, but I just want to plant the seed for that right now. And the other piece that you really want to look at is your project champion. So who's the leader? Who do people look up to in the practice? Who is there a provider? Is it your medical director? Who is it that really is that change agent, right? They're visionary, encouraging, and trusted, that can help this project lead be a guide to navigate the crew to make it really safely, and I would add successfully, right, down this QI river. And then you're preparing your raft. This is step 3. So for us in this conversation, the raft is the HPV vaccination QI project. The QI river we talked about is continuous, it's flowing. We're putting this raft in. We have our guides, that's all of you. And then we'd have parts of the raft. And to me, this is where PDSA cycles come into play. And our ropes are, process map and other QI tools, right, that we bring into our raft to help us successfully navigate this river. So in preparing the crew, I mentioned it earlier, that foundational piece of really making sure that your staff is prepared and that they are educated about not only this, but the project. So your project team, as well as other people, right? Your practice staff that are involved in this, and really thinking about, as you pull this team together, where they are in the practice, the roles they have, and really understanding each crew's member is critical in this raft, in our project for many different reasons. I always say too, and this also folds into process map work, which I believe you've had training on already, but thinking about when you're doing that, who's doing what step of that process map, who has that role, because I think that's really important, because then you can assign responsibility, which to me equals accountability. So if there's a piece of that that's not working, who is in charge of that piece and can kind of touch base with them to see what the challenges might be. And then obviously accessing previous knowledge and experience when you pull your team together. Who's done this before? Who, has been successful in this, and really, making sure that their thoughts and ideas are valued and encouraged to be brought to the table in this work. So here's where we want to all land, right? In quality improvement. We want to be here, right? We want to be down the river already. We want to be in this beautiful, calm place, which we know is not quite reality, right, in healthcare. But however, I do believe a piece of this is attainable in this work. So, and I think that as we map out the path through this work together, thinking about all these things we've talked about already and what we will talk about, quality improvement methodology, it can really help you get to this destination. So the science of improvement. So again, I just want to focus on that, even that title. It is a science, right? There is a science to this work. And really thinking about that. We're not just kind of pulling things out of thin air. This is, really proven to be effective and to really make change. And so the applied science used by the Institute for Healthcare Improvement, IHI, I use them a lot in my work. And this applied science is traced back to W. Edward Deming and his system of profound knowledge. And I have some links here on the slide where you can go in and look at that a little bit more deeply. We could, obviously, that could be a whole presentation on that alone. So the Associates for Process Improvement use this work by Deming to create what we call the model for improvement. Next slide. Within this, the two big pieces you need to remember, again, it was made famous about this model by IHI, and they use this to guide their healthcare improvement work. And the two main components to take away from this is three fundamental questions, and you can address them in any order. And then the plan to study act cycle, which you've heard us mention already, is PDSA cycles for small, rapid cycle tests of change. Next slide. So here's just a great piece that is right off the Associates in Process Improvement website. And so when we think about this, again, talking about the questions that we're going to ask as we think about what we're going to try to improve. And when we do that, what are we trying to accomplish? And this is really your guide to setting your aims. What are you trying to do? So we would like to increase our HPV vaccination rates by 5% by the end of 2024. And so, thinking about, again, each of these, and it's not like you answer one and then you're done. And then you really can there's no rhyme or reason how to kind of look at these, and the fact that you're going to constantly go back and revisit this. So keep that in mind. So how do you know that a change is an improvement? Because just because we make a change, we don't always make it, it doesn't always kind of go the way we think it's going to go. So that's why you have, I mentioned earlier, the process measures and outcome measures in place. And again, it's so important to go back and look at those, go back and talk to your staff. How are things going? I can't emphasize that enough as well. And then the third question is, what changes can we make that will result in improvement? And again, you want to bring your teams, when you bring them together, ask them for their ideas. You may have an idea in your mind, what you'd like to try and do, but to really build that buy-in and engagement, you want to ask them what they see and what they have for ideas. Next slide. So in thinking about this, so the PDSA cycle, really is a systematic process, and it really helps us gain valuable learning and knowledge for continuous improvement. And whether you're looking at a procedure, a process, or a service, for us, it's process, right, within this quality improvement methodology. And so your plan is, looking at, okay, how are we going to do this? We talked about this. So we're planning for our trip. We've already talked a little bit about that in the beginning. And so what's your goal? What's your purpose? Why are you doing this? What's your formulating a theory, right? You're saying, I think if we try this, this is going to do this. What's your theory? What are you formulating that as a team? And then defining your success metrics. Again, how are you going to know this is successful? And then putting a plan into action. So then you come into the do, which is your implementation, right? Those are your interventions that you're going to put into place. And so when you think of this, there really is a method, again, this scientific method, and it's called action-oriented learning. And so thinking back again to the do, right? Again, you're going to implement this. Your study is, you're going to monitor these outcomes. You're going to see, check and see how the process is going. What are the areas for improvement? And then your act is, again, you're going to close this kind of cycle and say, okay, what's next? Was this successful? What do we have to do to change this if it wasn't? Again, getting buy-in from your team the entire time, and the people that are boots on the ground as well. You may have to adjust your goals, You may have to change your methods, and you can scale up once you have something successful in place. That's when you begin to scale up. So I really can't, again, emphasize this enough that you want to really start small. And then once you've got some steps into place, understanding that, again, things may change as you scale up, but at least you've kind of done that first step of trying small and then scaling that success. And again, you'll hear me say this a few more times, but again, as you're planning these PDSA cycles and thinking about this, just kind of, again, in the back of your mind, be thinking about sustainability. These are just some resources that I put in here. I think they're going to put this in the chat for you. Again, we all don't want to reinvent the wheel. So these are just some PDSA worksheet resources that you may find and to help kind of guide the conversations with your team and thinking about the different steps we've just talked about. So again, in your backpack as your QI tools, I see this truly as a process map. This is really a key component of any PDSA work that you do, and evidence-based interventions, which sounds like you all are well aware of. I would share, I think there is an organic flow to this work. And I think that if you think about it from getting the patient to come into the clinic until when they leave, and then making sure that you're scheduling, say, that 6-month HPV vaccination appointment before they leave, there really is, just like the QI River, there's an organic flow to HPV vaccination work as well. So those reminders, getting them in, setting up the provider reminders, again, you can just see, and then making sure that you have information on hand to give them, making sure that the team is educated, making sure that you're talking about this in your staff meetings, just to step away from that piece. I just want to mention that, if you're in a project, please carve out 30 seconds, even if you have a full agenda for your full staff meetings, and always talk about the projects that you're in, because it keeps it in the forefront. It keeps it in people's minds. And, right, it's just not, we're launching this project and then nobody really kind of knows where you're at. So really important to think about ways to communicate with your staff. Next slide. I'm not going to go through this. I believe you already had this, but just a quick, reminder that the shapes mean something in this work and really important. So the next. So when I do this, and I think of a process map, I like to do PDSA cycles. And so I'm going to let this, so again, process map your current state. I have never, in all the time of doing this work, done a process map where there has not been one aha moment where someone thinks someone else is doing something. They realize that, oh my goodness, I thought someone else was tracking that. Who really has more time to be able to make those reminders? So again, I just cannot emphasize that enough, because that really helps you identify your gaps in care and where you want to have your PDSA cycles and where you want to start. Again, I've mentioned in the past, include everyone who touches that process should really be involved in mapping out that current state. It is time well spent. It really sets you up for success. And I use a yellow star. You can use whatever you want when you start process mapping to mark the area. To me, that's right. That's a place where you've identified a gap in care. And that is where you want to just, again, a lot of people are visual learners. And if you're sharing this with all your staff, also a great tool to think about when you're onboarding new staff. You can visually show them, here's our process around HPV vaccinations and what we do from how we remind them until they leave the office. And then again, like I just mentioned, then you can determine where you want to start in the process and start your test of change. This is just real quickly, just one that I had done really simply with a practice patient-parent reminder process. I won't go through the whole thing for sake of time, but you can see, again, you're printing the reports, reviewing them, comparing to the EHR. Is it well-child visit due? Yes or no? Your triangles are your decision points. And so for here, there was a PDSA cycle that they wanted to work on the outreach. So they've been doing letters and they're like, let's start with calls. Let's change it up. Let's try 2 calls first to see if we can schedule that well child or a vaccine-only appointment. And so that was where they wanted to focus that first change. And so again, you can see we're just kind of putting this out there and then showing staff where this is. I'm a visual learner and I know I appreciate this. And again, as you're doing this, you're going to identify other areas as well. So maybe you say, okay, that's our first PDSA cycle. The second one we're going to look at is if we get no response. So we've reached out twice. We haven't had no response. What do we want to do next? Do we do anything now? Nope, not really. We just kind of call them again in 3 months. Well, how about we try a letter? And how about we include some HPV vaccination material so they can really understand the importance of HPV vaccination as cancer prevention and truly prevent cancer. And so maybe we're going to add that to it as well. So that would be your next PDSA cycle. And so this is just real briefly some best practices that I have found in this work, like clear expectations I've mentioned before, assigning roles and responsibilities, equal accountability. You can check in with your staff how often to see how things are going, including project timeline, how often you're going to check in with them. And again, it's not to evaluate them, it's just to see how things are going. You want to build this culture within your practice. Study the results, and again, look for suggestions, and then start small. And again, like I mentioned before, and keeping sustainability in mind. So here we are together. We've got this raft, paddles, ropes. We've got the guides, the crew, the map, and off you go to test these PDSA cycles and really your quality improvement projects. So if you don't communicate, I know many of you have been, maybe some of you are new, and again, some of you may be doing this work for a long time, but it is so important to communicate. I would say educate. You can't over-educate and you can't over-communicate, truly. It keeps everyone on board, keeps everyone, moving together, and in our analogy, rowing down, paddling down the river together. So real briefly, I have about I think 1 or 2 minutes left here. Thinking about unexpected and expected challenges, navigating the QI River. So for me, that's rocks and rapids. So challenges are there. Sometimes you know about them and you can plan for them. They can be big or small, or they can be just under the surface. And I think of that, I think of maybe lack of staff engagement, like people just, have so much on their plates, but understanding that you're really trying, if you could go back, yep, if you're really trying to minimize, they're really trying to help them, right? You're trying to actually make their work go more smoothly so that they have more time to do other things. Change anxiety is a big piece, right? People are like, this is how we've always done it. I'm not a big change person. You could lack of time, staff burnout, and lack of resources. And again, thinking about all these things, right? To be able to understand to your staff, look, we're really trying to build this together to really give you more time in your day. Strainers, I think, are, in this analogy, an obstruction in the river that allows water to pass through, but it really doesn't flow smoothly. There's things that can kind of hold it up a little bit. So for us, again, it's lack of a quality improvement culture, like people not really understanding why it's important, lack of leadership, and maybe you have issues with your data. So always making sure that you're validating your data so that your teams feel confident in the data that you're sharing. And then finally, hydraulics, so resistance. That's what that is to me. And those of you that have been rafting, it's when the river comes under and it kind of goes under like either a rock or an edge, and it just continually swirls. And it can be very dangerous because, the rafts can get kind of tucked under there. So for us, that's resistance, and I think you need to always address that with staff. Like, we've always done it this way. I know some of you, that's hard for you, but I really like to have you try. Let's all work as a team, because it can be overt. You can have staff that are like, oh, we've always done it this way. Why are we doing this? And being prepared for that and understanding it's a normal response, and also subtle. So people may be resistant to it, but not really sharing that. So please don't ignore that, and identify and address the source if you can. So eventually the QI River starts getting calmer. It comes with experience and knowledge. It comes with practicing with your QI tools and your methodology. And again, building that positive quality improvement culture. And again, finally, right, we hope to be here where you have successful, sustainable workflows and processes that you're putting in place. And hopefully, just as everyone works together, your aims are achieved and you celebrate success together. And for us in this work, that's increasing HPV vaccination rates and truly preventing cancer. And I don't say this lightly, but we really, right, truly saving lives and impacting quality of life. So I'm going to end here and just thank you all again for having me, and see if there's any specific questions, or we can answer them at the end, Ashley, however you want to do that. But thank you so much.
Yeah, thank you so much, Jessica. And just we're gonna roll in and do questions for Jessica in the panel discussion. So if we could go to next slide, and then one more. Great. I'm going to introduce our awesome panel of speakers today who are going to share their knowledge and experience around PDSA cycles. So we have Rebecca Archer from Avent Health Medical Group, Caitlin Dickinson from Oregon Rural Practice-Based Research Network, Carrie McAfee from the University of Kentucky's Markey Cancer Center, and Mary Casla-Petracco from Stony Brook University School of Nursing. Thank you guys for being here. And so let's dive into a few questions. I'm going to start with Caitlin on this one. So from your perspective, why are PDSA cycles important? Thank you. Can everyone hear me okay? I just happen to have someone mowing the lawn right outside of the office window, so I apologize for the background noises. I am Caitlin Dickinson. As Tina was mentioning, I work for ORPRA, the Oregon Rural Practice-Based Research Network. We're a group affiliated with Oregon Health and Science University, and I'm physically based in Portland, Oregon. I was just so jazzed by Jessica's presentation. Thank you, Jessica. I loved the analogy of rafting for thinking about PDSA cycles. So I can be quick with this answer because I know like other panelists probably want to provide some thoughts about this too. But one of the things that I find most important about PDSA cycles is it really gets people excited and anchored to some of the quality improvement work. As Jessica mentioned, it does not have to be some big lofty activity that you're addressing within the clinical setting. It can be something small, really bite-sized for a team to address. And that's the thing that I think is really cool about them, that they do not have to involve huge components of the clinical staff member team. They don't have to be, again, something really extreme in terms of change. It can be something small that you want to address that can be an easy early win in the quality improvement framework for clinic teams. So that's why we tend to be pretty excited about encouraging teams to get behind the idea of adopting PDSA cycles.
Great, thanks. And I love that you say that. I think often we think of PDSA cycle, they seem so lofty and so great. And so thinking about it, just breaking it down into something small, if it just kind of feels like a lot at the beginning, is a great thing to tell everyone about. Carrie, I'm going to hand that question over to you. So again, the question, why are PDSA cycles important?
You know, I'm going to kind of go on what she said too. It's like it's not a one size fits all, right? So whether your practice is larger, whether you're implementing it with almost within anything, it started out with business, right? And it's just kind of grown into healthcare. And we did this a quality improvement project with pediatric offices. And of course, their whole teams were involved, from the front desk to the MAs to the docs. Um, and again, who doesn't want to improve on what they're already doing, right? So to me, I think that's just a bonus. And I also kind of just want to pivot for a second. For those of you that aren't always going to be working within the healthcare line of things when it comes to HPV vaccination, um, I was a part of the National Roundtable's HPV Emerging Leaders Program. I actually use PDSA cycles to develop an educational material and HPV vaccination toolkit. So you can use PDSA cycles when you're creating educational materials. It's an iterative process, right? So it allows you to make things more succinct, more educational, more user-friendly by all constantly getting that feedback and then incorporating that feedback in what you're creating. So whether it's healthcare or something even with materials, you can use PDSA cycles. Thanks for the question.
Yeah, Mary? Oh, you're still muted, Mary.
Okay.
Perfect.
And I'm really happy to be here too. I met people from your organization when I was at that National Immunization Conference, and I was really so excited that people were interested in my PDSA cycles. For me, this is getting the buy-in from everybody and making the whole team feel like that this is important to them. This isn't about me. This is about everybody who's working together to make things better for our patients. And that's kind of the way I've looked at. I have a small private practice. I worked for Suffolk County Department of Health Services for 30 years. So my identity is really that I'm a public health nurse. And it was the same thing when I worked for the county health department. It wasn't about me. It was about what we could do as a team to make things better for us as staff members and for our patients. And that's kind of the way, I've always looked at it. And, asking folks, well, what do we all together see that is a problem that we can solve with these PDSA cycles? So that's pretty much, I pretty much have the same things to say as what everybody else does. But for me, as I mentioned, it's a team thing. It's not just about me. It's not just about one staff member. It's about how we collectively can work together to make things better for us as a staff and for our patients.
Great, thank you. And I know Caitlin, you just said in chat, I've used PDSA cycles in my personal family life all the time. So they definitely can be practiced in many settings. And then Rebecca, same question.
I think that everyone here just beautifully kind of outlined the ease of use, I think, of PDSA cycles. I come from a larger medical group where we were trying to implement use of the vaccination at 9, obviously. And so we had lots of different strategies that were being used from different people. And I think the beauty and the importance of a PDSA cycle is to sort of get everybody on the same page and understanding what is the actual objective. And the way that I've used PDSA cycles is actually more of an exploration of maybe some other accessory types of projects that need to happen, maybe even before we head into something as big as, increasing vaccination rates. That can be a really kind of big thing to chew on. And so I have started in our clinics with simple things, and I'm sure we'll get into, more of that planning and process mapping. For us, it was almost a year or two of fixing the consent process that we have as an organization for the vaccinations itself. And so once we got to that, it led into a few different other PDSA cycles. And I think that's the importance of it, is actually getting to the fundamental root of the issue, and then being able to adapt and to edit your processes to have everyone be aligned with the same goal, which is still increasing your vaccination rates, but it might have to be in smaller bite-sized chunks as you get there. And that's what I enjoy and think is super important about the process model itself.
Great. And I love Jessica's analogy of taking us down the river too, because I feel like it's so great with this because you prepare as best to your knowledge, but then little things come up and it kind of makes you ebb and flow around a little bit. So the next question, if anyone was new to this process, how would they get started? And do you have any tips or tricks? I'm going to go back to Caitlin.
Yeah, I'm going to echo a couple things that Jessica mentioned because I thought they were really critical. I think the first thing is really understanding what your overall goal is. We also tend to use the model for improvement when we work with clinical sites. So starting with like a SMART goal or an aim statement of what is the overall big picture, what are we trying to accomplish with whatever topic is at hand. So if it's trying to start vaccinating at age 9, is it trying to improve completion rates for ages 13 through 17, and we want to see an improvement by X% by X date, like something where like this is our overall goal for a set period of time that we want to work on. So starting there is really important. The other component that we do is starting with some other of the tools that Jessica mentioned, using process mapping, workflow mapping diagrams. Someone had asked, so I'll throw it out there now, what kind of software we use. We use Lucidchart. I can put that in the chat for a software if people are interested in exploring that for those kind of activities. The other thing that we tend to do is a fishbone diagram to also explore like where are opportunities for change or improvement. And then from that, going into a PDSA cycle. So I'll end there, but that's kind of what I would say in terms of starting. We really try to start with identifying what's our overall goal, and then looking for where are some opportunities that we could change within our current structure, our system, and then breaking that down to small PDSAs.
Great, thanks, Caitlin. And feel free to share tools as well in the chat. Mary, I'm going to hand it over to you for the same question of just how would you get started? What are some tips and tricks?
And I apologize for the lawnmowers too, because there's lawnmowers outside of my window. Well, actually, the first thing I had to do was teach people what a PDSA cycle was. We had there's been an evolution about how we do quality improvement over time. So, I had for my particular, I have it's just myself and I work with another nurse, but we're always looking to make things better. We're public health nurses. So in our heads, it's like, we have to be the best because we'll feel terrible if we don't really do good at this because we worked for the health department for so long. So, I started out by getting some tools and talking about what a PDSA cycle was. So, of course, I went online and I looked for some things, and I went and I found a really good some really good tools at the Society for Pediatric Anesthesia, how to design and implement a quality improvement project. It was kind of like nuts and bolts about like well, what it is and what we needed to do. And then from there, we kind of looked at, we have a really terrific registry in New York State. We call it NICIS. And we looked at our numbers to see how they compared with everyone else's for our for our HPV vaccination. We see a ton of adolescents. And that's how we kind of got started with this project. Was Jan and I decided we wanted to get our numbers up. How are we going to do that? So I said, well, why don't we just do this PDSA cycle? And she said, what's that? So that's when I went and don't assume anything either. Assume that people don't really understand this process. Or they'll say, oh, what do I have to do that for? It's just some more work to do. But when you give people buy-in and say, well, this is going to collectively make us look good, and it's for the betterment of our patients, because what do we want to do? We want to stop cancer. So like I said, our big thing was, first of all, talking about what a PDSA cycle was and how it would help us. So and like I said, I look for something really easy, really simple, really small. And it was a one-page flyer that I pulled up from the Society of Pediatric Anesthesia that had basically all the tools that we needed in order to start a PDSA cycle. It talked about the Ishikawa, or the fishbone design. It talked about how to come up with a problem, and we kind of took it from there.
Great. And I love that you said don't assume anything, because I think we've all been a part of projects where halfway through you notice that everyone doesn't have the same knowledge base, and you're like, oh, okay, let's go back to the start and make sure we all have what we need to be successful. So I really appreciate you saying that. Carrie, same question, just how would you get started? Tips or tricks you have?
Yeah, so I'm going to go take a little left turn off of sort of what they said, because, I do evaluation. There's a lot that's in my wheelhouse. And I think that there are times when people want to do quality improvement in their practice, they choose the easiest path. Don't get me wrong, I do believe in low-hanging fruit. I think low-hanging fruit helps people to see that they can be successful, and it helps get them fired up and into something. To me, I think the most critical thing to get started is looking at your data. I can tell you how many providers think we're already doing great. We're doing great. We don't have a lot of missed opportunities. If you pull your data from your EHR, you will be shocked to know that your completion rates are not as high as you think. Your initiation rates aren't as high as you think. And your missed opportunities, there are a way to document those. And you can put stuff in your EHR that helps you to document that, because you may have talked to a parent once, twice, or whatever. That third time, and you can still put it in your EHR, because they're not missed opportunities if you've had the ability to talk with them, right? The missed opportunity is they came in for a sprained ankle and I didn't mention it, even though they're due, right? That's the missed opportunity. So to me, I believe in checking out the data first, because that then says, this is my aim. Our aim in this office, based on the data, where we need to improve is here. And then that aim, kind of going with what Caitlin also said, then we're going to start working. What are the strategies and activities that we can do? This is where those PDSA cycles come in to say, chunk, chunk, chunk. We're just going to chomp away at it. And let's start with that low hanging fruit, because then the office feels like, awesome, that one was accomplished. Let's gear up to the next one. So to me, I would start with data to try to figure out what the overall goal of the office or the project is going to be. Let that data guide you where your concerns or issues are within the practice or other organization.
Great. And then Rebecca, anything to add?
I'll just add, I love the data idea. I think a lot of us as healthcare professionals and associated with healthcare, we like to have proof of what we do works. And I think also choosing the right type of data. I realized through my work with the completion rate in particular, that's a slow moving target. It could take years for you to see a true effect of your PDSA cycles doing that. And so choosing the right data and starting there as a way of building your processes and your PDSA cycles from that is helpful, because then you can give more real-time feedback to the people that are helping you implement these cycles, giving you feedback about these cycles. So picking the right type of data to track is also incredibly important, because if you aim too high to start, it's going to feel very defeating for somebody that's just entering into doing quality improvement work and trying to implement this on their own.
Yeah, I love that. I think one of you spoke to the buy-in too. I think data helps so much with that at the beginning of why we're doing what we're doing. And so definitely speaking to us data lovers in the room, I'm sure. So we've all heard that PDSA cycles can be challenging. Can you describe a time that you experienced a challenge and then how you overcame it? I'm going to start with Mary on this one.
Well, our biggest challenge was the pandemic. We saw, because, and I hear what you're all saying about data, because, you know, having worked for a health department, I'm very data driven too, but we go right to NICES, which is our immunization registry, where everything is just right there for us in a neatly packaged little gift to see exactly. It tells us when, where, how many, and then we can compare our numbers to, you know, statewide, to other people in our county, to see exactly where we are with our HPV numbers. So the pandemic just knocked us right out of the ballpark. We decided we had this problem. Of course we did our analysis. I mean, that's one thing that I wanted to mention. Before you even get started, you kind of have to create your plan. Well, what it is that you need to do. We had defined our problem, that we were not happy with our HPV numbers. And we wanted to analyze what the causes were. So we looked at some of the things that the parents were saying, the children were saying, and then the pandemic hit. And we were able to get absolutely nowhere. The children weren't coming in. Our numbers weren't going up. I wound up throwing vaccine, having to get some expired vaccine back to the state because I had just ordered everything and we didn't use it. So it was a bloody nightmare. So sometimes you have to realize that your problems are outside of your control, which is what we had to understand when the pandemic hit us. So Jan and I kind of looked at things and said, well, let's just see when things start getting better. But then I wound up having to do house calls to a lot of the kids that I was taking care of in order to get their paperwork done to send them to college. So that was a perfect opportunity to bring along some HPV vaccine with me, because I've heard every one of you say every opportunity that we see children is an opportunity to vaccinate them. So there I was with my little cooler with my data logger in it, going and doing my house calls and bringing HPV vaccine with me, telling parents, well, don't you want to prevent the cancer on the way to, the kids are going off to college. You're not going to be able to see them as often. Let's make sure we get this vaccine into them, as well as their meningitis and their Tdap while they're on their way. So again, it was thinking outside of the box and making the most of the worst opportunity, but also understanding sometimes you don't have control when things don't go the way you want them to.
Yeah, I feel like that control element is a really good thing for us to remember during the PDSA cycles. Rebecca, same question. Any challenge that you've experienced and then how you overcame it?
Because I work with a larger organization, the lack of buy-in has always been a real big problem for me on different levels, you know, whether that comes from a leadership level or even those that might have a good intention of, well, of course we want to increase vaccination rates. We want to change HPV vaccination rates. But then when you get to the nitty-gritty of how we really need to go about doing that, you get that lack of buy-in, I think, more often, because the suggestions come with process change, and people don't like change sometimes. And so, you know, you have to sort of find the motivation that's more than just I want to improve the rates, because to me that's an exciting thing. I would love to see the rates improve. But to a nurse working in my clinic or to an MA that's carrying out an order, that might not be a motivator. And so I think that finding a buy-in that makes sense from the start, from the people that will help you implement this, is so critically important. You can educate all day long about the importance of early vaccination. completion of the series, all sorts of things that this group is very well versed in. But if you don't have the motivation behind it for the people that are helping you, it just doesn't work. And so for me, that came a lot with actually just rearrangement of our vaccination clinics, even just the way that we do consent forms. I found that some offices were doing them with the front office, which is to me an inaccurate process. You need informed consent. We had others that had the providers doing them. We had others that had our nursing staff and MAs doing them. And to see that wide variety, you know, again, we've said many times in this, don't assume anything. I assumed that because the way my clinic ran it, which is my nurse came in after my visit and got consent, I assumed that all of my colleagues were doing the same. That's not the case, because we've had workarounds. We've had staff that's worked with us for 20 years, and this process has worked well for them. So why would they change that? So even just changing those little things and saying, let's think about it this way. Let's put yourself in the shoes of a parent or the shoes of the patient that's trying to consent to this. Could you see from that perspective how this might not be motivating for them to sign the consent at the front office before they've even met you as a provider? So again, it's looking back at those buy-ins, both from patient perspectives, from administrative perspectives, from nursing perspectives. To me, that's always been the challenge in our small PDSA cycles, that we're trying to get onto a larger level, but sometimes it just takes very individualized efforts to get everyone on the same page.
Great, thank you. And you spoke to this next question, and I just want to hand it to Caitlin. I'm going to hand to you just about how have PDSA cycles supported sustainability of a project and leadership buy-in. I know Rebecca was just talking about how that's so important, and how has a PDSA cycle helped to support that future buy-in? And Caitlin, I'm going to hand that to you first. Maybe.
Sorry about that.
There it
I was
is.
trying to figure out how to get myself unmuted. Yeah, that's a great question. I think, sorry, my head was kind of in the challenges, and maybe what I'll try to do is spin my thoughts about around the challenges to answer this question. So I think one of what I was going to say for challenges that we've experienced is not having the right people at the table, the people that are going to have to do the work for the PDSA cycles and creating the PDSA cycles. So I think that that's one thing that I think is a cool opportunity with PDSA cycles, is bringing together a lot of different, it's kind of multi-level in terms of the approaches that you could take in the clinical settings, and getting more people invested and bought into the processes that need to be in place in order to drive quality improvement. So I think that that's one thing in terms of like leadership and approaches, is like being able to have more of the involvement from teams at all different levels, and being able to demonstrate that through some of these quality improvement processes. I think the other thing is it's really cool to be able to showcase the data behind PDSA cycles. So kind of going to what Carrie's saying, yes, starting at looking initially at what your data showcases and demonstrates in order to set your aims statements, but then also being able to, as you're working through PDSA cycles, track over time and seeing some progress and being able to report on that, and having a really clear way to be able to showcase that out. I put this in the chat, but one of the other things I love about PDSA cycles, and what I really encourage clinical teams to do when we work with them, is to be able to showcase them somewhere, whether that's like in a staff break room, or if you do like staff newsletters and you're able to say like, this is what we're working on this month, like being able to really like have a visual for people to be able to see that they're doing it. The last thing I will say that is kind of fun and gets maybe some buy-in from leadership and others is if you can create some friendly competition amongst clinical teams. So if you have like team A, you know, do the same PDSA cycle as team B, and then be able to see at the end of like whatever that time period is, who did better, and perhaps there's some incentive there, or some you know, team-based excitement around like trying to improve different rates.
Great. Thank you, Caitlin. And I think we're right about at time. So I think I'm going to end it there and hand it back over to Ashley. But I want to thank all of you guys for being on the panel, and thank you for the awesome presentation earlier, taking us down the QI River. And I'm going to hand it over to Ashley to wrap us up today. Thank you, guys.
Ashley, I think you were muted.
Yep. If you're talking, we can't hear you right now, Ashley.
Sorry about that. Sorry, I just was saying to myself, I guess. Thank you all again for participating, and thank you, Jessica, for taking us on that river raft, and to our panel for sharing all of your knowledge and experience with us on PDSA cycles. We really appreciate it. We are going to wrap up today's session and provide some tools and resources to you. So you want to go to the next slide. I've shared this before, and so has Tina, but we have our external facing website that we've built for all of you and all of our participants in the rural HPV vaccination learning community to be able to access all of the resources during our 10-month journey together. I do want to call attention to the top of the page under important links. This includes recordings and slide decks from our monthly sessions and our resource roundup. Under monthly recordings, you'll find past sessions, slide decks, and now you'll find that information on our continuing education, whether that be the live continuing education or the enduring. So for those that are listening to this in the future, and I'll have Gabby add a link to our website in the chat. And if you haven't done so already, I really highly recommend that you bookmark the website so you can access it at any time. Next slide. Additionally, we've organized a resource roundup with tools and resources from previous sessions. We're regularly updating this document, so if you have a resource you want to share with us, I'm happy to add it to our resource roundup. Please, email me or put it into the chat. You'll see that we did add some resources from our August session, so around evidence-based interventions, and look for a ton of new resources around PDSA cycles after today's session. We've gotten some really great ideas, and I will make sure to add all of them to the resource roundup. Next slide. I also want to point out we did add a new section on our website, which is general ACS resources to support rural communities. This includes a document from our sister organization, our Cancer Action Network. It talks about the cost of cancer. And then we have a new rural brief for state cancer coalitions. And you'll find all of those resources under our helpful documents and resources section. Next slide. Do you want to do a quick poll? So I'm going to have Gabby pull that up. And if each of you could just share, in the next 6 months, do you plan to use any of the knowledge that you learned today to test out interventions that you end up doing through your project and implementing PDSA cycles to really test out those interventions? And then what additional tools and resources do you need to support your success in implementing PDSA cycles? So I'm going to have you guys go ahead and take that poll. I will continue moving forward with just some more information. So while you guys are taking the poll, I will move along to our schedule of events. So our next session will take place in just about a month, October 16th. During that session, we're really going to deep dive into interventions around reducing barriers to vaccinations. So we're going to actually have a robust panel of partners sharing their unique and innovative ways that they have done that. So look for that October 16th. Next slide. And as always, we are hoping you'll be doing activities and using this information that we share during our monthly sessions in your work with rural communities. So once again, I encourage you to, look at our website. I'll ask Gabby to link it again in the chat, but please bookmark it for future use. Check out that resource roundup. And as we prepare for our October session, we ask that you really, finalize some of those evidence-based interventions that you want to try to implement to make changes and improvements within your clinic or your system. Begin implementing them and start testing out their success or their failure via PDSA cycle. And then next slide. I do want to share our CME and CNE survey. So as always, we want to know, how today went, what you liked, what could go better. So we do have a new post-session survey that we're asking our participants to complete to share feedback and claim those CME and CNE. So in order to receive credit for this activity, the participant must have attended the CME or CNE live. So this particular slide talks about that. So complete that program evaluation using the link in the chat, and then your CME and CNE certificates will be emailed within the next 2 to 3 weeks of evaluation completion. And then next slide, for those who are joining us in the future, this session will be made available on our website, and recordings will be available as well for enduring CME and CNE credit. For those listening to this session in the future, you'll want to scan the QR code to receive credit for this activity. And to receive CME and CNE for enduring participants, you must answer the post-test question and receive a 70% or better and complete the program evaluation. And then once again, those CME and CNE certificates will be emailed within 2 to 3 weeks of evaluation completion. And this session will be available for CME and CNE units until September 20th of 2025. And then next slide. I want to thank you all for joining today's session, and we look forward to seeing you once again on October 16th, where we'll be hearing from a panel of participants sharing on reducing barriers to HPV vaccination. So thank you all again, and thank you to those that participated in our poll. I really appreciate it, and have a good rest of your day and week.